patient monitoring programs have been very effective for managing hypertensive patients, primarily because traditionally in the past, patients would have to come in to the doctor's office or clinic to have their systolic diastolic measures taken, documented, and then review their medications, see what side effects and changes needed to be made, and then try to adjust the medication dosage to get the best outcomes, right? But then what would happen is the patients would then go home. You may not see them for 4 to 6 weeks or several weeks, so there's this gap that happens. So the ability to interact with and adjust the medications based on the readings were extended out. So with the advent of remote patient monitoring and the ability now to connected Bluetooth devices with cellular-enabled phones and tablets, makes that data collection in the home by the patients more convenient, and then that information now being available for review by the care teams remotely, it now makes it easier for them to track those readings and make any necessary changes for their patients so that you can improve the time that it takes to get patients on their optimal dose of the medications to get them the best outcomes. Depending on the program type and the scale and scope of the programs that you're trying to build, you essentially are going to have to get buy-in from the participants, right? So you've got not only the doctors, the nurses, but the patients. So once the patients are educated on the benefit of these type of programs and what they get to gain from participating, once they get enrolled, they're able to get these devices sent to them at the home. They start using them, they get training remotely, and there's any support. If there's support needed, they get that benefit as well. So the enrolling the patients is one aspect, getting them comfortable with collecting this data. And then the second piece of this is the care teams, having the protocols and the ability for this information to be easily integrated into that workflow on the clinical side, makes the adoption of these programs more beneficial and efficient for scaling, so that while you're in your workflow, you review the data, you can write the orders, make the changes necessary, and if needed, also improve that communication. And then ultimately, the way that this gets supported long term is depending on the patient population being part of a value-based care or in a fee-for-service world, there's different type of ROIs available. Depending on where the organization is in their spectrum of care from fee-for-service to value-based care, there are clear ROIs in terms of overall cost savings and outcomes for value-based care programs to get patients better managed and on track to achieve their goals for managing their hypertension. In a fee-for-service world, there are now CPT codes available to collect and review and modify the care plan. So again, depending on where the patients are in the ecosystem of this transition, as health systems and hospitals are kind of straddling both worlds at the same time, you can optimize for whatever it is that you're trying to achieve in terms of ROI for your health system. The benefit of having, as with everything, a lot of changes have been happening recently with scaling and improving access to care for a lot of these programs, primarily for RPM, right? When you have these data sets inside your EMR, patient-reported data, device data coming into the ecosystem now within your EMR, the other tools that your hospital and health systems are investing in, primarily around automation and using AI algorithms and workflows now, unlocks more efficiency for your system. So, there's layers to this, right? First, you get the doctor-patient working together remotely. The data then comes in. Now you get to understand what are the workflows that your remote care team has been working through, where there's opportunities to optimize that with AI workflows, enhanced workflows, and by further applying other population health resources that are now embedded within your EMR system, it helps you to make sure that these programs are performing. It gives you more flexibility into now scaling these programs across your system more broadly. As these technologies evolve, uh, the ability to improve access to more patients in different populations, especially in rural areas, the way the infrastructure now is being deployed, uh, access to these type of programs is improving in a way that increases equity for a lot more patients. So it's good to see how these programs are going to grow in the near future.